Hi, I'm Dr. Amanda Ferrell. I'm the Medical Director of Breast Imaging at Baptist Health. So women should start coming for mammography at age 40. There's been a lot of controversy, different societies say this, say that. The science says come when you're 40, come once a year. That is the best way to find cancer as early as possible. So what are the different kinds of mammograms? In the old days, we used to only have film screen mammograms. So you actually had film like Kodak film. And then we got an advancement that was full field digital mammography. The latest advancement is called tomosynthesis or 3D mammography. So instead of just looking at a two-dimensional image of the breast tissue, we're actually looking at very thin slices acquired through the breast tissue. It makes it so that a cancer is less likely to hide on a mammogram. Having a 3D mammogram or tomosynthesis mammogram also makes it less likely that you'll be called back for something that's going to end up being just normal breast tissue. We can tell on those 3D images that something is just a little island of normal breast tissue without doing extra imaging.
I'm Dr. Stephen Routon. I'm a radiologist and a breast imaging specialist. So ABUS is automated whole breast screening ultrasound. Now, a lot of women have had an ultrasound of their breast before. Maybe they've felt a lump or had a certain problem with their breast during a diagnostic examination, or maybe a radiologist has found something on a screening mammogram. This, however, is a newer technology that allows us to ultrasound a woman's entire breast. And we actually do that in conjunction with your mammogram. It doesn't replace it. So when a woman comes for a screening mammogram, certain women may benefit from whole breast screening ultrasound, namely those with high risk factors for breast cancer or women that have dense breast tissue.
So the other difference in mammography is whether you come for a screening mammogram or a diagnostic mammogram. For a screening mammogram and a diagnostic mammogram, we start with the same basic images. The real difference is in the patient population. If you're having no problems, you're living your life, no breast symptoms, you haven't felt anything new, your doctor hasn't felt anything new, you're going to come get your 4 images. You'll go home, we'll read them. We have 30 days by law to read them, but typically we read them within 24 hours and let you know the results at that point. For a diagnostic mammogram, either you're having a problem, your doctor has felt something, or you have a personal history of breast cancer, or maybe we're following something on your imaging that we think is okay, but we want to see a few more times before we officially say it's okay. So for a diagnostic appointment, it's a longer appointment because you're not going to leave our department until we have done whatever combination of mammograms and ultrasounds are required for us to decide that you're okay for another year. You're probably going to be fine, but we'd like to follow something at 6-month intervals for 2 years. Or maybe you need a biopsy, but you will not leave until we make that decision, and one of our radiologists will communicate those results to you in person at the time of your appointment.
So the ABUS is done in addition to your screening mammogram, and often it's done the same day. Not every woman would benefit from it, but some women that have more risk factors for developing breast cancer or women that have dense breast tissue. More and more women now are being notified of whether or not they have dense breast tissue, and that's a component of the mammogram report that you get and that your doctor gets. So if there's uncertainty about it, you can certainly ask your primary care doctor, or you may even ask the technologist once your mammogram's done, whether they think you might benefit from that due to your breast density.
If you have any questions about breast imaging or mammography, please call the Baptist Breast Center for further information.